Hello, everybody, and welcome back to the podcast. I hope that everybody is doing good. Today's episode is going to be a solo episode, and it's going to be on something that I get asked about. It doesn't come up a lot, and I think so when it does come up in somebody's pregnancy, it can feel a little bit unknown and perhaps a little bit alarming. So I want to talk about it so that you understand what it is, why it happens, and kind of what the evidence says. And that is polyhydramnios. So a little bit of a mouthful. As always with these types of episodes, this is just about giving you clear evidence-based information so that hopefully you can feel informed and you can make decisions that feel right for you and your baby. So let's start with what polyhydramnios actually is. Polyhydramnios is the term used when there is more amniotic fluid around your baby than expected for your stage of pregnancy. So amniotic fluid is the fluid that surrounds your baby in the womb, and it plays a really important role. It cushions your baby, allows them to move around, supports their lung development, and helps regulate their temperature. The amount of fluid naturally increases as pregnancy progresses, and then it usually stabilizes or slightly decreases towards the end. Polyhydramnios is diagnosed when the fluid level goes above what is considered the normal range. So in the UK, this is typically measured using ultrasound. And there are two main methods. One is called the amniotic fluid index, often called AFI, where the uterus is divided into 4 sections and the deepest pocket in each is measured and added together. And then the other one is the deepest vertical pocket measurement, which looks at the single largest pocket of fluid. Generally speaking, polyhydramnios is diagnosed when the AFI is greater than 24 or 25 centimetres, or when the deepest vertical pocket measures more than 8 centimetres. Mild polyhydramnios tends to fall just above these thresholds, while moderate and severe cases are higher. Now, hearing that you have too much fluid can understandably sound quite alarming, but it is really important to stress that most cases of polyhydramnios are mild, and in many cases there is no clear cause and outcomes are still very positive. In terms of how common it is, polyhydramnios affects around 1 to 2% of pregnancies overall, so not hugely common, and the majority of those are mild cases. Moderate and severe cases are much less common. So why does polyhydramnios happen? Amniotic fluid is constantly being produced and removed. So your baby swallows the fluid and then passes urine, and this balance helps regulate the volume. So anything that affects that balance can potentially lead to an increase in fluid. In some cases, there is an identifiable cause, and one of the most common associations is gestational diabetes. So when blood sugar levels are higher, this can lead to increased fetal urine production, which can increase the fluid levels. Another possible cause is related to the baby's ability to swallow. Certain conditions that affect swallowing or digestion, such as gastrointestinal blockages, can result in fluid building up. There can also be associations with fetal conditions, including some chromosomal differences and infections, although these are much less common. So it's really important to emphasise, in a large portion of cases, especially mild ones, no cause is actually found. This is referred to as idiopathic polyhydramnios. Oh, that's a mouthful. And it often resolves on its own or remains stable without causing significant issues. So if you are told you have polyhydramnios, one of the first things your care team will usually do is offer further assessment to try to understand if there is an underlying reason. In the UK, that might include a glucose tolerance test if you haven't had one, or a repeat test if there are any concerns about gestational diabetes. It may also include a more detailed ultrasound scan to look at your baby's anatomy and growth, and sometimes blood tests to screen for infection. As always, it's always your choice which tests you accept. You can ask what each test is looking for, how likely it is to find something, and how the results would influence your care. So let's talk about what polyhydramnios might mean for your pregnancy and birth. With mild polyhydramnios, many people go on to have completely straightforward pregnancies and births. Often the main change is that you may have a few additional scans to monitor fluid levels and your baby's growth. As fluid levels increase, there are some potential risks that your care team may discuss with you. These can include a higher chance of your baby being in a non-head down position, so such as breech or transverse, because there's more room for movement. So the more fluid there is, the more freely your baby can move around. There is also a slightly increased risk of preterm labour as the uterus is more stretched. However, this risk is still relatively low, particularly in mild cases. Another thing that is sometimes discussed is the risk of cord prolapse. So cord prolapse is when the umbilical cord slips down below the baby when your waters break. This is more likely if your baby is not well engaged in the pelvis at the time your waters release. There is also an increased chance of postpartum hemorrhage because the uterus has been more stretched and may not contract as effectively after birth. So it's really important to put these risks into context. While they are increased compared to pregnancies without polyhydramnios, the absolute risk for many of these complications remains low, especially in mild cases. One thing that can sometimes happen is that people are offered induction of labour based on a diagnosis of polyhydramnios. This is where it becomes really important to understand the evidence and your options. So in the UK, guidance from the Royal College of Obstetricians and Gynecologists suggests that management should be individualised. So there is no blanket recommendation for induction purely based on mild idiopathic polyhydramnios. For moderate to severe cases or where there is an underlying condition, there may be stronger recommendations for planned birth, but even then, it should still always be a conversation about risks, benefits, and of course your preferences. If induction is suggested, you can ask questions like, what is the specific reason for recommending this? What is my individual level of risk? What are the benefits of waiting for labour to start spontaneously? And what are the risks of induction in my situation? Because induction itself, as we know, comes with its own set of considerations, including longer labours, increased need for interventions, and a higher likelihood of assisted birth or caesarean. There is also sometimes discussion about controlled breaking of the waters in hospital, particularly if there is concern about cord prolapse. So this might involve having your waters broken in a more controlled setting with monitoring. And again, this is something you can explore with your care team. You might want to ask whether this is necessary in your specific case, especially if your baby is head down and well engaged. So let's talk a little bit about monitoring. If you are diagnosed with polyhydramnios, you'll likely be offered additional scans. These are usually to check fluid levels and your baby's growth, and the frequency of these scans can vary depending on the severity. Some people find reassurance in this extra monitoring, while others may find it increases anxiety. It's okay to talk about how it feels for you and to ask what is essential and what is optional. You may also be advised to be aware of your baby's movements and to contact your maternity unit if you notice any changes, which you should be doing anyway. This is standard advice in all pregnancies anyway, but it might be emphasised more if there are additional considerations. In terms of symptoms, some people with polyhydramnios notice increased abdominal discomfort, a feeling of tightness or breathlessness due to the extra fluid. Others may not notice any difference at all. If symptoms become uncomfortable, there are occasionally medical treatments that can be discussed in more severe cases, such as amnioreduction, where some fluid is removed. This is not commonly needed though, and is usually reserved for significant symptoms. Now, I want to take a minute just to talk about the emotional side of the diagnosis. So hearing that something is outside the normal range in pregnancy can feel really unsettling. It can obviously understandably bring up fear, uncertainty, and a sense of losing control. So if you've been told you have polyhydramnios, you might notice that your care becomes a little bit more medicalized. There may be more appointments, more conversations about risk, and potentially more pressure towards certain interventions. It's really, really important that you remember you still have choices, you still have autonomy, and you are allowed to take your time to understand your options and make decisions that feel right for you. You might find it helpful to write down questions before appointments, and you can come back to this episode and write down some of the questions that I have said already. Bring a birth partner with you or a doula, or maybe just ask for time to think about decisions rather than feeling like you have to agree to anything on the spot. If you're planning a home birth or birth centre birth, you may be told that polyhydramnios changes your options. This really varies depending on the local NHS trust guidelines and the severity of the condition. So in some cases, especially with mild idiopathic polyhydramnios and no other risk factors, people are still able to choose a midwife-led setting. In other cases, you may be advised to give birth in an obstetric unit. If this comes up, you can ask what the specific concerns are, whether there is flexibility, and whether a personalised care plan can be created. So let's bring this back to hypnobirthing and preparation, because even with a diagnosis like this, the tools that you have for staying calm, informed, and confident are still incredibly valuable. Understanding your body, understanding the physiology of birth, and having techniques to manage stress and discomfort can make a huge difference to your experience. If anything, when there are additional variables, these tools become even more important. So breathing techniques, relaxation, visualization, and positive language can all help you stay grounded and reduce the impact of fear, which we know can really influence how birth unfolds. Your birth partner also does play a key role. They can help advocate for you, ask questions, and support you in staying calm and focused. So to quickly summarise, polyhydramnios is when there is more amniotic fluid than expected. It affects around 1 to 2% of pregnancies, and most cases are mild and have no clear cause. There are some associated risks, but in many cases, outcomes are still very positive. Management should be individualised, and you have options when it comes to monitoring, testing, and decisions about your birth. If you take one thing away from this episode, let it be that a diagnosis does not remove your autonomy. You are still at the centre of your care, and you are allowed to ask questions and to explore your options and make informed decisions. If this is something you're currently navigating, then you're not alone and support is available. As always, if you want more support with preparing for birth, understanding your options, or building confidence, you can find details of my hypnobirthing courses, doula support, and power hours in the show notes. Thank you so much for listening. If you have found this helpful, please do share it with another pregnant person. Please do like, subscribe, review the podcast, and I will see you in the next episode.